Democracy is the government of the people, by the people, and for the people. And when certain set of people are elected into political position in the office to serve the people, it is expected that they deliver on their electioneering promises and making sure that the mandate of the people are justified. And as it has continued in its effort at interfacing with all the ministry, departments, and agencies of government, the government delivery unit is not relenting at ensuring that the feedback mechanism to drive home the agenda of government under the leadership of Prince Abeokuta is upheld adequately. That is why scorecard is put together to ensure that people are served with expected feedback to tell them that, okay, this is what this administration has been able to do. You voted us in, we are delivering on our electioneering promises, and we are making sure that you are not disappointed. That is why the government delivery unit is also here to bring to us this program, Scorecard. Welcome to Scorecard today on Ogtv. My name is Morenikeji Shobaloju. Leko Onomusi is the special advisor to the governor on delivery, and is here in the studio with me today, as we do always. Today, I don't know where we're going. We've been through different ministries in the past, but he is here to tell us where he's taking us to today. So join me as I welcome on the show today, Mr. Leko Onomusi. Nice having you today.
Thank you so very much, Morenikeji. It's really nice to be here today. We appreciate we're not taking the opportunity for granted. Thank you very much. This is one of series of interactions that we have been having. The object of this interaction is to bring to the public front a stewardship and accounting mechanism to our people. We've been around quite a number of agencies. The object of this is to come and account to the public what the government has been doing since we were given the mandate in 2019. The Government Delivery Office, our duty and job is to actually interact with all these agencies to make sure that all their implementable deliverables and intentions are brought to completion in a way and manner that is expected. And we also have a reporting obligation to the people. So it's not just good enough to be undertaking projects and initiatives. It's also very good to communicate these initiatives to the people so that they know and know where they can actually fit in. We are going to have the opportunity of engaging with the Honorable Commissioner, Ministry of Health today. The Ministry of Health, or the Health, is one of our developmental pillars in the Ishaya mantra, upon which this administration puts their strategy across. We are captured, the Health Ministry is captured under the social provision of the S in the Ishaya. And His Excellency Prince Abeokuta has been so passionate and has been so dedicated to ensuring that the Ministry of Health lives up to his ethos. The object is to be sure that health facility and health delivery is brought very close to the people. The people are the sole beneficiary of this particular ministry. When we came into government, the first thing that was done was a total assessment of the existing health situation across the states. And reports came back to His Excellency. And I do recall one of the first places that His Excellency visited was the Olabisi Onabanjo Teaching Hospital.
Yes.
And I was privileged to be part of the crew. And I could understand the way His Excellency felt when he visited that facilities. He declared a state of emergency there. And a lot of work was done on that particular one as one of the places that His Excellency did within the first 100 days. Within that first 100 days, the major objective of His Excellency is to make sure he reaches out to the people across the state. And he felt the best way to reach out to these people is to actually get the primary health care facility going across all the wards of the state, because the primary health facility is the first responder in any health situation that people experience. If that's where you go to when you have malaria, fever, typhoid, or you need some form of immunization or the other, that is your first point of reach. And His Excellency did an assessment of the existing status of those primary health facilities across the state. And it came to him that a lot of work needs to be done across the divide of these primary health facilities. So, marching order, we needed to get one primary health facility at least in place in each ward of the state. And like you know, we have 236 wards across the state. It means that he has the job to put 236 in place at a, as a plan. Now, we know we couldn't afford to go into the 236 because they are contending issues to the limited resources of the state. But His Excellency gave an order that we should go in the tranches of 100 by 100 and 100. And I'm quite glad to know that I have been around a substantial number of this 100 that has been done. And I can tell you that work has been completed in at least 100 as we are going now. Some of them are at the final stages of work to be done. These primary health facilities, if you go there, they are resourced with personnel, doctors, they have midwives in there, they have laboratory supports there, they have immunization mechanisms there that you can reach out and people can get sensitized with all the immunization requirements that has to do with the child's growth. Also, you will see in most of these, if not all of the primary health facilities, there are ambulance services attached to be able to move people from the local areas to that ward in case their situation, they can tap into that. This is part of the drive that His Excellency President Abeokuta has to make sure that healthcare facilities reaches the people at the point of need. This is a government that he says it and he does it. He declares, he knows exactly what he wants to do, and he puts structure and mechanism in place to be able to make sure that this is done. I mean, we have to commend also, in addition to His Excellency President Abeokuta, we have to also commend the Honorable Commissioner for Health, who is a lady that I've seen hands-on dealing with issues and attending to issues just to make sure that the object of governance actually reaches the people. We've spoken about the primary health care. There's also the secondary, tertiary, because there are different levels of health facilities that caters for different kinds of, and work is ongoing on a lot of all these places. To be honest, I'm not the one that will come and speak to all the specific. I'm just going to set the tune and create a platform for communication, which is what we are doing across all the MDAs. This program is just not a program of showcasing what His Excellency is doing in the health area. We are also talking about education, we are talking of infrastructure. So we have a responsibility to report the diverse. But today is the Ministry of Health, and His Honorable Commissioner will be here to give a line-by-line report of all what they have been doing, so that our people can know exactly where to plug in, what benefits they have, the impact of all these initiatives. But let me make it very clear that I am privileged to be saddled with this responsibility of being able to see what is happening across the divide of all the MDAs. And one thing I can tell you, that a lot has been done across the divide, of all of this administration. The primary health care initiative is the first point of contact for the wider public, be you in a remote environment or within the city center. It is the first point that you go to, to make sure you have access to medical support that you may require. And that's why His Excellency, in his best wisdom, feels that we have to do something to reposition all the various primary healthcare facilities across the state. My recollection, I stand to be corrected, the Honorable Commissioner will speak to that, but I'm sure we have over 500 primary healthcare facilities spread across the state. Of this, the plan is to have one functional, well-equipped PHC in each of the wards of the state, and I think it's about 236. So ever since this government came in, the first initial marching order is that, look, we have to start revitalizing all these PHCs. Now, of course, we can't handle the old 236 at once. So His Excellency have taken them in segments of 100, the next 100 until we get to the final 236. As I speak to you, I have been privileged to visit quite a number of those PHCs. I've seen at least about 20 or 30, and I'm quite amazed and impressed with the extent of work done and the kind of facilities and access that you can have. It covers basic things like typhoid, you have malaria, you have fever, the kind of places you can go into. And more importantly, I think they have antenatal facilities. There was a particular one that I visited, and they were having immunization lectures going on to people to educate them and bring how they can best take advantage of that facility. So I think, and I commend His Excellency and the Honorable Commissioner for Health in this drive. We are making strides. We're not there yet. There's still a lot of some work to be done, and we are consistent in dealing with that particular, to expand that particular initiative. And also, you will also recall that at a time, His Excellency made it key priorities to make sure, because they recognize the logistics challenges that may come up within the, in terms of transportation. So they made arrangements and improved the ambulance services that is attached to each of those primary healthcare facilities, whereby they can move people from their local environment if they need to, and bring them to where they can get the first attention. So that is part of what they are doing. There's been a lot of investments in state hospitals, which we've been part of how it is managed, And I'm sure when the Honorable Commissioner comes, like I said, she will speak to all these things in greater details for people to understand. She will speak about the purpose of those initiatives, the impact of those initiatives, how benefits is streamlined down, She's going to tell us the way it was before and what we've done so far. These are going to be some of the communications that will, which is the purpose of this interaction, so that the people of Ogun State can know how far we have gone as far as health improvement is concerned in the states.
Going forward, so how do you, as a unit, your own office, how do you sieve all this information? How do you get, the communication in essence is what I'm trying to look at now. As a unit, you have the responsibility to also manage what they do in the ministry. Probably if you're looking at, if it's a project now, you are there from the conception of the project, the action plan, all through to the implementation. So far, how do you see that of the Ministry of Health? Has there been that mutual, agreement and understanding between your office and the ministry?
Thank you. Very good question. This office is less than 2 years old. The first 1 year was applied to setting up the office, putting up the necessary framework. And the second year, we went on to actually starting the work. Of course, when the work started across the ministries and we have to actually sensitize people about what this particular office is all about. There were contending issues, conflict as to, but we made it straight to people and explained to them that the purpose of this office is nothing but to support the goals and aspirations of the respective MDAs. We are to support you to achieve exactly what you want, set objective. So we are just here as an instrument that you use in order to do what you want to do properly. So there's a clear implementation plan and reporting mechanism attached to that mandate. We needed to work with the MDAs. At the same time, we have a reporting obligation to both our principal and the people of Ogun State. They are stakeholders in these things. And there's a way the communication goes by, number one, is relationship. When you maintain a good relationship with the promoters of the agencies, you will know when projects are going to start. We get a lead from His Excellency that gives us direct instruction to go and undertake some activities. We get reports from ESCO telling us that these are the initiatives and programs, and we also go through the budget by interfacing with the various MDAs. So we know that projects are being undertaken, or the plan of the agencies. And also we do request for strategic plan of each agency. So we have an idea exactly of what we want to do. Now, once we get those things, our work is strictly divided into 4 or 5 areas. Number one, we sit with them at the planning of how that project or initiative is going to be undertaken. When we sit with them, we have an idea what they are thinking, how they want to go about it. Our work is to listen carefully to the process they want to adopt and to also see if there's any risk or any areas of improvements in the plan. Once we complete the planning stage, we move on to the implementation stage. The object of the implementation stage is just to say that what we are planning or what we have planned is being implemented the way and manner that we have both agreed at the implementation stage. We put in monitoring and evaluation mechanism to make sure everything is going on, and at the same time the final point is the reporting obligation, which is what we are doing at this present time. Reporting to the public so that the public knows exactly what people are doing, also feedback to our principals so that they have an idea.
Looking at it now, would you say that so far the ministry has been able to deliver as expected, or the deliverables and what is expected of the ministry? What can you say about this before we allow the Honorable Commissioner to come and tell us all they have been able to do? But having the record with you are interfacing with them, you have a synergy. So do you think the ministry has been able to do, what is expected or more than?
Yeah. The health sector is very, very key in the mind of His Excellency President Abeokuta, without a shadow of doubt. My office is to provide support to almost all the MDAs, but in this particular case, we just don't interface with the Ministry of Health by ourselves. We have a special consultant that is engaged by His Excellency to work with us in order to carry out this assessment. I know every year that the leadership of the Ministry of Health provides a strategic document which states out clearly what their deliverables, what their intention is every year. We sit with this document. That's our first document to look at. We look at this document, we highlight the various things, and we now trigger these things up to make sure that yes, we have this thing as a plan, but how far well is it implemented? That is where we step in. And to be honest, there will be constraints, there are constraints. I'm not here saying that we have achieved everything, but what I can tell you that substantially, significantly, a lot has been actually achieved within this space and within this time period, and we must recognize that in order to inspire His Excellency and also to inspire the Honorable Commissioner, who is charged with the direct responsibility to make sure this is done.
Thank you for being part of the show.
Thank you so very much for having me. Thank you.
A state of emergency was declared by His Excellency Prince Dapo Abiodun at the inception of his administration in the health sector, and a lot has been done in that ministry. Don't go away, stay tuned, and we'll be right back to take you through the details. Glad to know you're still there watching Ogtv. I said earlier on when we were about to go for that short break, I said when this administration came on board, the administration of Prince Dapo Abiodun, he declared a state of emergency in the health sector, where he visited the Olabisi Onabanjo Teaching Hospital, and to an extent he felt terribly bad with the state of the hospital then, and afterward a state of emergency was declared in the health sector, and a lot have been embarked upon to ensure that this sector is repositioned and being able to achieve its set goals. Today on Scorecard, I have the Honorable Commissioner for Health, Dr. Tomi Koka, join us to discuss and take us through all the achievements of this ministry since inception. Join me as I welcome Honorable Commissioner Tomi Koka.
Thank you very much for having me this morning.
Dr. Tomi Koka, before you find me, let me just put the doctor.
It's all right.
So nice having you join us this day. I was about doing your job in a way, telling people what the governor did and all of that. But I know it's your position to tell us. So far since the inception of this administration and up till now, what can you tell us about, giving account of the ministry's stewardship?
Thank you for the opportunity for us to share our achievements, particularly His Excellency's achievement in the health sector. On arrival, this administration, as you mentioned, the Excellency actually declared a state of emergency in the health sector. And you'd ask why. At the inception of this administration, what His Excellency met on the ground were dilapidated health facilities. The entire infrastructure, majority of them were dilapidated. The equipment were aged, and there was a lack of health workers. So immediately, His Excellency went into work in a systematic way. And as you know, the health sector is divided into 4 major areas: the primary sector, the secondary, the tertiary, and the public health response, which most times people actually ignore. And it's the public health response that responded to the COVID and deals with all our outbreaks. With that, we successfully managed the COVID response. If you remember, we were the first state. But because of the proactiveness of His Excellency, we actually didn't have as much casualties as other states would have had. And when the pandemic struck, we actually had no molecular lab in Ogun State. As we speak, at the height of the pandemic, we had 3, but as we speak, we have 2 permanent molecular labs in Ogun State that can respond to any outbreak. And if you listen to the news, there's always a constant threat of an outbreak. So as a state, we don't have to worry about that. There's a molecular lab that is integrated into the isolation center, which is permanent in Olabisi Onabanjo Teaching Hospital. And there is a molecular lab here in Abeokuta, the capital of the state. But His Excellency has gone a bit further than that. He's actually building a purpose-built emergency operations center, which is a situation room for any outbreak that would be electronically supported. It's like when you look at an airport, you know, the tower room where you can see. So from the center, we can see where outbreaks are. If there's anything happening in Imeko, if there's cholera or diphtheria, we can see it here in Abeokuta before it happens. And that construction is going on right now in Iyano Mortuary. On the same site, we also have 2 laboratories. That's the virology laboratory and the bacteriology laboratory. Previously, we had no reference lab. We had to take our samples either to Lagos or to UCH. But now we can process our samples in-state going on in the future. Lastly, we don't have a blood transfusion center as a state. And we have women, you know, thousands of women having children in Ogun State. So His Excellency is constructing a purpose-built blood transfusion center that would serve all the parts of all the 3 senatorial districts right here in Abeokuta. What does that mean to the citizens? It means that your blood will be assured not to be HIV positive, not to have hepatitis, and it will be provided at a very cost-effective rate. So that's the public health response aspect. Then we'll go to the primary health, which is the bedrock of any health system. And with the primary health center, as the essay to the governor on the government delivery unit had mentioned earlier on, we have 538 primary health center across Ogun State. Unfortunately, when we came, over 60% were not functional. So we embarked on a program where we did, you know, cluster by cluster renovation, and we continue to do that. In each local government, each cluster would have at least 1 PHC. So His Excellency has committed to renovating at least 1 functional PHC in each ward, and we have 236. To date, we've renovated almost about 100. And in the last 3 months, we've actually constructed 2 brand new primary healthcare center. One is in Itoko that has never had a primary health center. And then there's one in Ibiadi in Ogun Water site that was built from the scratch. They had a bat-infested building that the local government had donated. And we continue to do this because until we reach the 236, we will not stop. But it's not just about the infrastructure. When you're revitalizing the primary healthcare center, what you're doing is you do the infrastructure. We also equip. We make sure that we have a reliable, clean water source, which is, we make sure there's a borehole that supplies the PHC and the people in the environs. We also make sure, where possible, that we leave a solar system so that there is light in the PHC so that we can have 24-hour services. But all this does not make a functional PHC without the health workers. So what we've done in this administration is we've employed over 80 midwives into the primary healthcare system so that when people access our primary healthcare, they have people to attend to them. We've also employed doctors, about 40 doctors, which we make sure that they rove around the local government. Each local government has at least 2 doctors. Those doctors go Monday, Tuesday, Wednesday, to different health centers within the local government to ensure that there is access to medical care, not just midwifery care. All this is to expand the services that is provided at the PHC level. Prior to this administration, most of the primary health centers were seen as maternity centers. But during this administration, we've transformed this. We're creating a system where it serves both male and female. So the children go, they get their immunization. The women go, they get their maternity care. But the men and the elderly people go there and get checks for their blood pressure. They get checks for diabetes. And actually, Ogun State is one of the 2 states in Nigeria that are running the national hypertension control. I was talking about the primary